What's up, everybody? Thank you for tuning in to my channel. It's an honor to have you here. Today we're talking about A1C. A1C is great because it does not lie, and it kind of stinks because it doesn't lie, and it's something you cannot study for. So I've spoken to people who like to study for their tests. If they know they're getting a liver function test, they might kind of take it easy, stop drinking, or if they're getting diabetes tests, they might start behaving better a couple days before the blood draw. Really, that doesn't work, and it especially does not work with A1C. A1C is a measure of glycolated hemoglobin, and all that means is the sugar will bind to hemoglobin, and it's a way to sort of see what over the past 3 months what your blood sugar is, and it's a way to kind of it's really the main clinical outcome for studying but it's basically a guide for studying how well you're doing with your diabetes. So if your A1C is up, a doctor might add more medication, prescribe lifestyle changes, most likely add more medicine. If it's going down, they might say, great, keep doing what you're doing. So it's really something that is an important thing. You should know what your A1C was on your last checkup, and it's something you should be following. So the goal in diabetes is usually under 7%. Some doctors might be more aggressive and shoot for under 6.5%. A person without diabetes has below 5.7%, and you might be wondering, well, why don't we look at why don't we shoot for perfection and go under 5.7%? And the reason for that is that adding more medicine and trying to get under 5.7 is a great way to become hypoglycemic. And hypoglycemia is the #1 complication of diabetes drugs in general, or diabetes regimen. And hypoglycemia can range from just being kind of shaky, hungry, to being agitated or confused, to going into a coma and dying. So hypoglycemia is very serious. Anybody with diabetes has experienced it, most likely, because it is super common. And if your diet changes but you keep the medicine the same, hypoglycemia can kind of be an issue. So there's a lot of ways where one could get hypoglycemia. So pre-diabetes is between 5.7 to 6.4%, and that should be like a wake-up call for people. That means the diet needs to change. Carbohydrates need to be removed from the diet. Activity levels should go up. I'm a big fan of like a ketogenic diet. I think that's great for people with prediabetes. I think that sticking to a diet like that, or at least kind of looking at carbohydrates in your food and trying to reduce carbs, don't have them all the time. Don't make it all meals shouldn't have carbs in them. I think that's a great way to reduce chances of prediabetes from going to diabetes, because prediabetes almost always means that there's a progression to diabetes. So it takes a strong will to overcome that. It is certainly possible, but it's not possible if things don't change. So prediabetes is an A1C range of about 5.7 to 6.4. Diabetes is 6.5 and above. And just like how most people progress from prediabetes to diabetes, a lot of people progressively get their diabetes to be worse, especially if they don't treat it with medicine and they don't change their diet. So, A1C is great because it doesn't lie. It's a 3-month average blood glucose. So if you see here, this is a chart from the CDC, and I've seen these numbers be higher, but this is CDC. They say A1C of 7 is about 154 milligrams per deciliter, basically your glucose reading. 8 is 183 on average, 9 is 212, and 10 is 240. And it's important to understand what A1C means, because A1C numbers are usually in the single digits. So A1C of 9 is not good, but I've heard patients say that A1C of 9 is great. You know, I've got my A1C of 9, it's pretty good. No, that's not good. It should be 7% or under, and that's what people should be shooting for, or even some doctors will prescribe a more aggressive goal of 6.5, depending on other factors. So definitely know your A1C if you have diabetes or prediabetes, and work on that number and try to get it down. I think it's a good goal to shoot for a lower A1C, especially if you're above, you know, if you're above what the goal is. So I hope you all found this interesting. If you did, please give me a thumbs up and please subscribe. It would be awesome to have you as a subscriber. I want to thank you guys for watching. Thanks a lot.